it?
Everything hurts. Mostly my hips have been hurting a lot lately.
What do you mean?
It just hurts. I can't bend. I can bend one leg in, like when I'm crossing my leg, but I can't bend the other.
Okay.
And it just shifted. So now I can bend the other one, but not this one.
Which one was it first?
First was this one, my left one.
You couldn't bend what?
I couldn't bend my leg like. Well, I still can, I guess.
What do you mean?
And
bend?
it hurt. Oh, I can't bring my hip down, and it just hurts. It all
So
this.
you can't
it feels
cross
like
your legs.
correct. And I
Okay.
could pull. Well, this one not anymore. I just hear it all cracking. But before this one's pretty flexible. I can mess with it.
Okay.
Now it seems like
started when?
Oh, I don't know. It's been a while.
5 years, 4 years, 10 years.
Probably I would say 5 years.
Okay.
Where I actually started noticing it.
And was it a gradual kind of came on, or was it something you did something, a trauma, an injury?
I think it was an injury. I played football.
Okay.
I took a lot of hits.
College and.
Yeah, high school and college. At work, I actually slipped and fell right on my glute pretty much.
This isn't work comp though.
No. This was a few years ago. This was like 4 years ago.
Okay.
And I fell, and I was like, nobody was there, so I was like, I'm gonna walk it off. And I was like, I struggled walking out.
No witnesses.
Yeah, no witnesses, and it was fine. I was like, I thought it was just a bruise, but it could have, because it was a good hit, and I'm a pretty heavy guy, so I'm sure it did something.
Okay. So that's the number one reason you're here?
That and my back. Every now and again, if I try and straighten it, I took a hit in football once with a helmet right on my spine, and every now and again it stings.
Middle of your back or lower back?
Middle.
Middle of
like
your back.
right, like dead center.
Okay. But the number one reason you're here is the hips and the back.
And my shoulders.
Okay. Well, we're going to get to it.
Yeah.
So we're going to go order of importance
Mm-hmm.
or order of severity.
Okay.
So the most severe for you is going to be hips.
Correct.
Number two is?
I would say my shoulders.
Your shoulders.
Yes.
Okay. Tell me about the shoulders.
I used to lift pretty heavy weights, and it slowly started hurting. Once I stopped.
Bench at 150?
Yeah.
Don't look at me.
And it was just,
give you a hard time.
It's okay. I think I was pushing it too much.
Okay.
And then when she got pregnant, had our daughter, I completely stopped going. And then everything started
So you're just
hurting.
benching her then?
Yeah. And
so she's how old? How old is your daughter?
5.
5.
Oh, so you haven't been in the gym 5 years?
Yeah, you can see that I've gained 5 years worth of weight.
All right, it's okay. All right. And now you're working.
Yes.
Sitting. Are you sitting at a desk, computer? Are you active?
Both. I'm active most of the time.
Okay.
So.
Different awkward positions.
Correct.
Okay. Not a problem. What else?
Ankles.
Ankles. Tell me.
I had I want to say a 3rd degree sprain on this ankle. Yeah, it was pretty bad.
3rd degree meaning you severed the ligament?
I didn't sever it. They said it was like there, like hanging on by a thread.
Okay, so
And
grade 2, grade 3.
Yes, and then I went to therapy, and then I just kind of let it go.
When was that?
2000, I would say 2010.
Okay.
And I went to therapy for a few times, and I just kind of blew it off. And now I have to wake up and stretch it because it's too tight in the morning. It hurts to
Only
walk.
the right. How about the left?
The left is fine.
Okay.
I tore my MCL playing football. I don't
When
know
you
what
say
that is.
MCL, so medial collateral ligament, right?
Mm-hmm.
Was the medial meniscus also affected?
I don't know. I wouldn't be
Okay.
able to answer that.
All right. What were you doing when it happened?
I was in a football game. I took a hit, and I was standing, and my knee went down.
Okay, so you didn't take
Inward.
a direct hit to the knee, though?
No.
Okay, got it. So, let's recap just a little before we start. Number 1 is hips and back.
Mm-hmm.
Number 2 is going to be shoulders and neck we're going to include with it.
Mm-hmm.
Number 3 is going to be the ankle. Yeah.
Mm-hmm.
And what else?
Middle of my back, like my shoulder blade area. I took a hit in football when I was like a freshman.
Okay.
And I got a stinger, what they call the stinger,
Mm-hmm.
and from there I've always had like stiff neck. Like from that point on, I remember just
Interesting.
every now and again I can't move my neck. Last time I couldn't even stand up.
Okay.
And my mom said, she's like, your back looks swollen. I was like, really? I was like, rub it out. So she's like trying to rub it out, and it just wasn't helping.
Got it. Okay. What else do I need to know about you?
That's it. I'm hoping that's it.
So these are the dimples.
Right.
Let's focus on the dimples here. Go ahead and walk. Focus on the dimples. Just keep walking. So he kind of hunches over when he walks, right?
Mhm.
And his spine kind of goes like this,
Waves.
right? It waves back and forth. That waving is compensation. That
Mhm.
waving is happening because something down low is stuck.
Mhm.
Stop there, march in place. Knees up a little high, look straight ahead, please. Good. Close your eyes, keep marching. See how that right foot wants to go, he's
Yeah.
starting to veer
Yes.
to the right?
Yes.
And then he wants to pronate. Okay, stop. But you see how both of them do that?
Yeah.
It's not one. When both of them are doing it, I'm thinking the sacrum. If one of them's doing it, I'm thinking the pelvis. March in place, turn around and face the other way, please. March in place. So I'm looking at the dimples, right?
Mhm.
That left one doesn't look right to me. The right one goes up and down.
Yeah.
The left one goes up, but it doesn't want to come all the way down. What are you saying?
I'm seeing the right side lower than the
Correct.
left side.
Now stop, just general terminology. Looks like there's a love handle here,
Mhm.
but not so much here, right? You
Right.
can see one crease, you can see two. This is because of the spinal alignment. That's not because of anything else. Now, let's look here where my fingers are. Okay, go ahead and raise your right leg as high as your right knee, up and down. Now the left side. Yeah, the left one's not moving though. And down. Right side. Right moves, left side. Left don't move. So we're just running the meter on the spine. We're getting about a 10-point reading at the top left. It's higher up though, like possibly occiput. I mean, just scoping him here, you can see his left ear is higher and comes back, so his left ear looks bigger to me from here. His head is doing this and this, almost like an ASLP atlas on the left or potential PS occiput. Come over here on this side, I need you to see this. Check this out. You can see this ear is higher than that. It looks bigger too because it's doing this. It's gone up and turned back. That's why it looks like that.
Mm.
You see what I'm saying?
Mhm.
Okay, let's continue. So C1, maybe occiput up top. Use between the shoulder blade. So what's our goal here? What are we trying to do here? Trying to get back in balance?
Yeah. No, I feel like even when I'm sitting, I feel like I'm shifting one side. Like I'm leaning toward, like I'm on my right butt cheek, I guess.
Okay, so we got base sacrum around T6, 7 and C1 occiput. Just kind of feel what's going on here. And you can see and feel right about here it changes. And that's where it is. This one more, this one more. It's dead. So you can hear the hollow.
Yeah.
This is the lung area, right?
Pretty good.
You hear the difference though?
Yeah.
Yeah. 1, 2, 3, 4, 5, 6, 7. 6, 7. Which one's more tender?
I think it was 6.
6, 5. 6, 7.
6. That's a big bag.
S1. That's S2. That's what I was showing you, okay?
Yep.
S2, not so bad. Tender. L5.
Not too bad.
This is S2.
Oh yeah, that one hurts.
This is tailbone. This is all that football.
Mm.
Okay, 7, 6, 5. Ooh.
Oh yeah, that hurts.
I'm I mean, I'm pushing a lot harder there though.
It's
Bend left, let me do the work. Turn left, turn right, head down, turn left, turn right, turn left, turn right. Interesting. So head up, we're isolating lower cervical spine. Okay. So here's what's interesting here. He feels, we're getting a reading up there, C1 occiput, but he's more restricted in extension, which is more lower cervical. Okay, then when we go down into, is that okay there?
yeah. I mean, it's tight, but I mean,
Is that tighter for you there or tighter for you here?
right there.
When I look up, when you look up, right?
Mhm.
Yeah. So I'm gonna wait on this one. I'm gonna do T6 and S2 first, and then we're gonna recheck the neck to see if what's changed. If it's still there, then I'll work on it. This is a little different than what you may have seen before where I go for the upper cervical first. And the reason why is it's not consistent. So if I would have got the reading there, the restriction, everything is pointing there, I would have gone with it. Now, last thing I want to do, let me just check the motion of the atlas occiput this way. One finger on the transverse, one on the mastoid. I'm looking for my fingers to open up and separate. One on the atlas, one on the mastoid.
Something popping in there.
They're both stuck. Go ahead and bring your toes back as far as you can. So there's two things going on here. It looks more restricted than it is because there's a short leg on that right side also, okay? So it may be coming back. Wow. I can't even straighten out his legs. Yeah, that's the pelvis. Okay, relax the toes. Tender in there.
Yeah. Oh.
Tender in here though too.
Oh yeah.
Not as bad.
Mm-mm.
Okay, let me do the work. Talus medial tilt. Relax this one. There it is. Good. I'm gonna roll you. Let me roll you. Bring your body back a little bit. So I got a deal with everybody, okay? If I drop you, I send you to Hawaii. It's been my deal from day one. So I'm being a little mindful right now, okay? Because somebody may have heard it and say, hey, so just in case.
That's a lot of weight coming towards you.
No, you're good. You're okay. It's all about the angle. There we go. Nice and easy there. ASI. And relax this up. There it is. Good. Good. Breathe. And out. Good. There. Roll. Gotcha.
Oh, I heard that one.
Sheesh. That's a home run. Oh,
Walk it
come on
off.
up. Walk it up. There you go. Keep going. Now everything's popping.
Yeah.
Everything's trying to shift this.
Keep walking. You said 6'5", correct?
Yeah.
Okay. Keep walking. And then you know the table.
Yeah.
Knees up a tad. Belly button down to the floor. Are you okay on your chest there?
Yeah.
Do you feel tight up top at all?
A little bit.
Okay.
Not too bad.
Step away for a second. I got to get the right angle. So let's try that. Try that. Tell me if that's more comfortable than the last position.
It feels about the same.
Okay. Knees are good. Right knee back a little bit. Okay. Tummy down. Knees forward a little bit. That's it. That's it. Tummy down. Bring your chest down a little bit so I can get so your stomach can hang better. There you go. Bring your knees back about an inch. That's it. Bring your knees back back some more. Okay, knees apart a little bit. Let's just knees back a little more. Keep going. Knees in a little bit. What I'm doing here is I'm waiting for it to release at my hand. So I'm feeling everything that's going on down here. That's it, baby. Chin up. Now, bring these hands here. And let your tummy just go down.
I wasn't expecting that one.
Which one?
That one you just did. I wasn't expecting you to go like right then and there.
It was deep. That was the idea. Okay. So this is your xiphoid
Okay.
here.
Mm-hmm.
This here, so the belly button can go down
Okay.
easy without restriction. Bring your knees up a little bit. Cool. Turn it down. Oh, gotcha. Come on up.
You know what? I thought they were exaggerating in the videos.
What you talking about? What you talking about? Jeez, they're so smooth.
Yeah.
It's pretty funny.
That's good. Jokes aside, though, things are moving better now.
Yeah.
Yeah.
I feel like I'm not like waddling, I guess you can say.
Oh, we did T6, S2 left pelvis. You are clear there. Let's see if I still need to do up top. Remember, was it to the left?
Mm-hmm. Clear.
Clear. Clear. 6 is clear. The neck is clear. We didn't have to touch it. S2 is clear. Slide forward, please, sir. Let's check the motion. Let's check S1, S2 first. Right?
Yep.
I'm going harder just so.
That one's still.
I'm going twice as hard though. Okay, so let's recap again. This is 5.
Mm-hmm.
This is S1. This is S2. That's the one we did.
That doesn't feel too bad.
Okay. Doesn't feel so bad now.
Yeah.
Okay. Next, scoot back for me, please. Turn your head to the left. Turn your head to the right. Look down. Tell them the difference, please.
Oh, it feels a lot looser.
We didn't touch the neck. Look up. Different.
Yeah. Doesn't feel like it's pulling on something.
Sit up straight, please. Set your shoulders. Oh, let me do the work. Over. Let me do the work. Don't help. Don't help. Drop your hand. Drop.
I don't feel like I'm doing anything.
You're holding your arm up.
Oh, sorry. I didn't feel like I was doing it.
Relax. Let me do all the work. Don't help. So am I. There we go. Right, Ruby?
Ooh.
Scoot forward, please. Let's check. We didn't check the pelvis. Let's check motion of the pelvis. Feet together. Open and close the knees. Right side only. Left side only. Senor.
Yes.
That's different. Right side only. Left side only.
It's moving.
They're moving. So what we need to do here is work all this scar tissue out, okay?
Yeah.
And there's 2 types of things we need to do. One is working all the periarticular swelling and crud out. That's doing this, right?
Mhm.
Working effleurage and working it back into the joint. This is for periarticular. Intra-articular is through passive range of motion.
Jeez.
Okay. 2 parts. Part 1,
Oh.
Part 2. And down. There you go. Raise your leg up and down. There you go. Turn to your left side up there.
Can't. I lost a ton of strength. I got in an accident.
That feels stronger to me.
No, there's no way. I know for a fact.
Okay, squeeze. Distal radius. Lunate. There, scaphoid. Go like that 5 times. Squeeze now.
Oh, I got it.
Back.
Yeah, that one's always been stronger though.
This is still almost out here. There. Squeeze. Squeeze. Good. Squeeze. It's back. You do feel that, right?
Yeah. Oh yeah, that's been like
Still
8
good.
years. Took me a while. Oh.
There.
Oh.
5 more times, each hand, both. Check this out. Squeeze hard, solid, squeeze.
Oh yeah.
Squeeze. There you go. Senor, that's where we're going to start.
All right.
Questions?
When's my next appointment?
I will do that. But you see, you came in and you said your shoulders and your neck, all that was number 2.
2.
Move your shoulders right now.
Oh yeah, that feels good.
Right?
Yeah, they usually pop all the time.
No gym right now, just cardio, swim, bike, walk, hike.
Okay.
Okay? And then I have a video called Flossing for Your Spine. Check it out. Start flossing your spine.
Awesome.
You brush your teeth,
Every day.
you flush your spine, or you flush your teeth.
Yes.
You flush your spine now.
All right. Thank you.
Welcome to the office.